Imagine going in for a routine dental procedure and ending up with debilitating, lifelong pain.
The pain is really bad. I feel that my mouth is on fire all the time.
Or being told you have stage 4 terminal cancer only to later find out your life could have been saved years earlier.
He had to go on oxygen. We had to take him to the emergency room, and he all but died at that point.
This nightmare became their reality, both at the same public hospital system, the University of Washington. And an NBC News investigation found they're just 2 of dozens of settlements at UW that included non-disclosure agreements, a tactic usually employed by prominent figures to quash allegations, or by businesses to silence disgruntled employees. Not as commonly discussed at taxpayer-funded institutions like UW. Ruby Blondell lost her husband Douglas Roach to cancer in 2020, just 3 years after his diagnosis. According to a lawsuit before he died, Douglas discovered that a UW radiologist had allegedly spotted a lesion on his lungs in a scan back in 2012 and marked it, quote, critical. But the lawsuit said no one from the hospital told Douglas or his doctor, allowing the disease to spread until it was too late.
Modern medicine is extremely complicated and mistakes are made all the time. It's a question of the gravity of the mistake in question.
Douglas, an attorney, pursued a lawsuit against the University of Washington, and 2 years before he died, they settled the case for $5 million. The university admitted no wrongdoing.
I'm glad we got some money, but there's no sense in which that makes up for having lost my life partner.
Susanna Greaser went to UW Hospital for a broken tooth repair in 2016. But when she woke up from a 3-hour surgery, she said she was in intense pain that never got better. Years of agony even led her to consider suicide. Finally, Susanna saw another dentist who discovered a nerve in her jaw had been partially obliterated. The dentist later telling state investigators it was due to, quote, medical error. After filing a notice of claim with UW, the University of Washington paid Susanna and her husband, Mark, $600,000. None of the dentists nor the hospital admitted any wrongdoing, and the Greasers had to agree to an NDA.
I was feeling that they were looking to only care for themselves and not us, and that they shouldn't be allowed to serve the public with that kind of attitude.
That lack of transparency, as you well know, means that things carry on behind the scenes the way they always have.
For most of Paul Luvera's 55-year legal career, he advised all his clients to not sign NDAs as a condition of settlement.
The benefit is all to the party paying the money because it's kept confidential. I've turned down some very significant amounts offered.
NBC News found that the University of Washington included NDAs in 70 of the 89 settlement agreements from 2015 to early 2023, requiring patients and their families to keep silent as a condition of settlement. But the irony is, since UW is a public institution, the details of those settlements are publicly available, meaning the only people who cannot talk about them are the patients. In a statement, UW said, quote, this, like many healthcare organizations, including publicly owned organizations, UW asks for confidentiality in order to achieve finality and certainty when a claim concludes. But Susanna and Mark believe they must speak out, even though by breaking the NDA, it could put them at risk.
I want to see an actual adjustment that we're going to serve the people that we're here to serve instead of putting ourselves above them.
Ruby Blondell, who is still complying with her NDA, cannot speak about the details of her husband's lawsuit, but is vocal about confidentiality not preventing accountability.
And I don't know if it will produce any change, but if it led to people being held accountable in the future, that would be a good thing.
Yasmin is joining us now from New York. And what kind of accountability do these patients want to see, Yasmin?
They don't want it to happen again. I asked Susanna's husband, Mark, that exact question. What do you want to see change here? I think that they don't necessarily think there will be significant change within the system they were treated by. But they don't want it to happen again. Put yourself, Tom, for a moment in their shoes, right? Finding out that a lesion was spotted on your husband's lungs years before he was diagnosed, and then he subsequently died. getting dental surgery, that the pain was so bad that you considered suicide. And then you cannot talk about it because of the settlement you received from the institution that in fact treated you. And so they want to be able to talk about it, and they don't want it to happen again. And that is the accountability, Tom, that they want.
You know, and UW has such a fantastic reputation. We go to them all the time for experts, and you got to wonder whether some of that reputation is because people who've had issues have signed NDAs.
Well, and I will say UW is not the only public health institution that has actually asked for signage of NDAs when it comes to these settlements. There are many public institutions that, in fact, ask for these NDAs as well. So they are not alone in that, hence the reason why we also put forward the statement from UW in that piece that you just saw. And again, there have been many cases, but it doesn't necessarily mean the institution itself, right, is totally, has gone to extremes when it comes to wrongdoing. But nonetheless, it is problematic, some of the cases that we have been investigating, Tom.
Yasmin, thank you. Great work. Yasmin Voussouguian there.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.